Good afternoon, Representative Stubbs. Thank you for being with us today. We appreciate the opportunity to speak with you. We are all nursing students from Marquette University's Masters of Science in Nursing program. We are here to represent our learning community and families affected by gaps in postpartum care. My name is Jaslyn, and I will serve as our facilitator for today. We will then have briefly share a story demonstrating how this issue affects patients and families. Keegan will then explain the major issue points, evidence, and impact on the community. And Yara will close us out with presenting our legislative request, document your questions and feedback, and coordinate our follow-up. We are here today to discuss Assembly Bill 1088, related to postpartum home visits, extended care for postpartum patients, and continuity of maternal health care services. We're here to ask you to support legislation that expands postpartum coverage, which will strengthen follow-up care and improve access to mental and physical health resources to new mothers. We also appreciate your work on the Public Safety Committee and Women's Legislative Network, the Committee on Correction and Health, and the Committee on Health, Aging, and Long-Term Care. We believe this issue connects with the goal of protecting safety, reducing preventable maternal complications, and ensuring families receive the care they need during the critical postpartum period. We'll start with Bree. She'll begin to explain a brief example of why this issue matters to patients, families, and nurses.
Thank you. I would now like to share a real case that inspired us to propose this bill. During a home visit, our nurse assessed a postpartum mom who had recently given birth and discovered that the mom's blood pressure was dangerously elevated. The nurse contacted the primary care provider, developed a follow-up plan, explained the warning signs to watch for, and instructed the mom about when to seek emergency care. Later, when the mom developed a severe headache, they recognized it as warning sign, followed the nurse's plan, and went to the hospital, where she got diagnosed and treated for HELLP syndrome. This is a serious complication that can also occur after childbirth, and up to 24% of pregnant women with HELLP syndrome and up to 34% of babies die from the condition. A third of maternal deaths occur in the first 6 weeks following delivery, and another 30%, including those from mental health complications, occur in the time between 6 weeks and 1 year postpartum. Postpartum is a very critical period where we, as healthcare providers, could save many lives with the proposed home visits. As in this case, without home visit, the elevated blood pressure might not have been recognized until the condition became even more dangerous. This bill would give Wisconsin families the opportunity to receive that same kind of early support in their own homes, an assessment of physical recovery, infant feeding assistance, emotional screening, and connection to follow-up care without cost sharing. A postpartum home visit can provide a critical safety bridge between hospital discharge and routine follow-up care. Keegan will now explain the broader evidence and how this issue affects Wisconsin families. Thank you.
The central issue is that many new mothers and infants do not receive adequate postpartum support after leaving the hospital, which increases the risk of preventable complications and missed opportunities for early intervention. This matters because it affects patient safety, maternal and infant health outcomes, and access to essential postpartum care. There are three important issues that we would like to emphasize. First, postpartum complications are a significant concern here in Wisconsin. In 2022, more than 1 out of every 150 delivery hospitalizations involved at least one severe maternal complications. Wisconsin's Maternal Mortality Review Team also found that among pregnancy-related deaths reviewed from 2020, 38% were associated with mental health conditions and 29% were caused by cardiovascular conditions and hypertensive disorders. These are the exact type of physical and emotional concerns that an early postpartum assessment may help identify. Second, research suggests that postpartum home visits can improve important outcomes for parents and infants. A Cochrane review of 16 randomized studies found that individualized home visit care probably improved maternal depression outcomes. Home visit programs may also improve exclusive breastfeeding, reduce unplanned infant health care use, and increase parent satisfaction with postpartum care. The evidence is not strong enough to claim that one home health visit will prevent every serious complication, but it supports home visits as a useful method of providing early assessment, education, and support. Third, a recent United States evaluation illustrates how these services work in practice. Among 541 families participating in postpartum nurse home visiting programs, nearly 14% screened positive for depression and more than 19% screened positive for anxiety. Almost 94% received at least one referral for a healthcare or social need. At the home visit, approximately 88% reported greater confidence in breastfeeding, and 75% were providing at least some breast milk at 3 months. Participants also described the home visit nurse as an important connection between the family, healthcare providers, and community resources. Wisconsin Assembly Bill 1088 offers a focused and practical response. It would allow a person who recently gave birth to request one postpartum home visit. During the visit, an authorized provider could assess physical recovery, assist with breastfeeding or infant feeding, screen for emotional wellness conditions, and connect the family with follow up care. The hospital could provide the visit directly or coordinate with an authorized outside provider, and the family could not be charged cost sharing for the covered services. This visit would not replace the parent's postpartum appointment or the infant's routine medical care. Instead, it would create an early safety bridge between the hospital discharge and continued care. When transportation difficulties, physical recovery, newborn care demands, and limited appointment availability may otherwise prevent a family from receiving timely support. For families in Wisconsin, this could mean earlier identification of physical or emotional concerns, stronger infant feeding support, and direct connection to needed healthcare and community resources. Based on the evidence and its potential benefit to Wisconsin families, Yara will now present our specific legislative request.
Thank you, Keegan. So we've heard a real story about what happens when new parents fall through the cracks after birth. And we've seen the evidence on how that gap affects patient safety and postpartum care across the states. Based on all of that and how this affects families in your district, we are asking for your support today. Specifically, we are asking for your support on AB 1088. Would your office be willing to co-sponsor this bill? And if it hasn't reached your committee yet, would you consider reaching out to the Committee of Health, Aging, and Long-Term Care to help it move forward towards a hearing? Just to recap on what this bill does, AB 1088 will guarantee a postpartum home visit within 14 days of a request. That visit can be done by a doula, a midwife, or a licensed provider. It is free for the patient. Hospitals cannot bill for it. Insurance has to cover it with no copays and no cost sharing. We would like to know, is that something that we can count on your support for? We really appreciate you hearing us out today. Whatever questions or concerns that you have, we would be more than happy to answer them. We will attach our contact information along with a one-page summary of the bill and the evidence that we have covered today. We'll also be sending this directly to your office by Tuesday, July 21st. And we'll follow up with your staff within 2 weeks just to check in if there is any other questions. Thank you for your time.
Thank you, Yara. Lastly, I just want to thank Representative Stubbs. Thank you for being with us today and discussing the lack of postpartum support for mothers and infants. The main message we hope you take from this visit is that many postpartum complications, like physical, emotional, and safety related, occur after families have already left the hospital. Yet mothers do not receive timely follow-up care, and that this postpartum home visit bill requiring a visit within 14 days of a mother's request offers a practical way to provide early assessment, reduce preventable complications, support breastfeeding, identify mental health concerns, and improve outcomes for both the mother and infant. We appreciate your consideration for our request to support legislation ensuring that any postpartum mother in Wisconsin can receive a home visit within 14 days when she requests one. We also appreciate your feedback regarding the need to ensure adequate staffing and funding so home visiting programs can be implemented equitably across urban and rural communities. Yara will provide the information we discussed and will follow up with you in about 2 weeks' time. Thank you again for taking your time for for your service to our district in the state of Wisconsin.